welcome to Boomer Health at Home. I'm Megan Girvin, Clinical Nurse Supervisor for Ameristaff Nursing Services. Today we have the pleasure of having Dr. Faust back with us today. This is Dr. Russell Faust. He's the Medical Director of Oakland County. Today we're going to be talking about the COVID vaccine, learning about it, getting some questions answered. I'm sure a lot of questions that people have, so time to get that information out there. Hello.
Hi, Megan. It's great to see you again.
You too.
Thanks for inviting.
You are welcome. So the biggest question I've been getting is, what is an mRNA vaccination? Because it's not, what people have been used to getting or hearing about. So
Yeah, that's a great question and very common. Well, I was a PhD in molecular biology before going into medicine. I'll try not to make this an hour and a half lecture on mRNA vaccines. But the bottom line is, this is awesome. Historically, there are basically three ways to make vaccines. All the vaccines that we're using now are made in one of these three ways. And those all require growing up lots of virus in eggs. Yeah, chicken eggs. So you may have seen these photos of, pharmaceutical vaccine manufacturers with these racks and racks of literally hundreds of thousands of eggs where they're growing big batches of virus. And then from there, they do a couple things. They'll take that virus and smack it down, make it less active so that it becomes a attenuated live virus or live attenuated virus for a vaccine. The second way is to take all that virus, purify it out, and literally kill it and use that as the basis for a vaccine. And the third way is to take all the virus out of the eggs and try to purify out some portion of viral proteins. For example, spike protein, you would try to do that. The problem with all of those three methods is that invariably you end up with egg products in your vaccine. And that's primarily the problem with the very serious adverse reactions that people will have to vaccines are these other proteins, these egg proteins, for example, or other viral products that weren't purified, with either, with killed virus, you end up with everything in that virus, RNA or DNA, all the proteins, all the lipids, and with live attenuated virus, if you're immunocompromised, there's the potential to become severely ill, potentially die from a live attenuated virus-based vaccine. The beauty of the mRNA vaccine is that a specific stretch of RNA that codes for the spike protein is used and nothing else from the virus. No other proteins, no DNA, no RNA, nothing else from the virus, just that one little message. And that message codes for the protein so that if we can get that message into our cells, our protein synthesis apparatus, the ribosomes, will actually stick onto that message, crank off a bunch of protein, spit it out, and our immune system will recognize it as foreign because we just don't make that protein. And so the challenge was how to get it into the cells when you use it in a vaccine. And basically, they make little nanoparticles. They take little bits of mRNA and wrap it in lipid, use that to inject. And again, the beauty is it's a very simple and limited vaccine. Not a lot of byproducts in there. We synthesize up the messenger RNA. It's very clean. There's nothing else in the vaccine. And so far, these two vaccines, these new mRNA vaccines, have been the safest in vaccine history. That is, in the now hundreds of thousands of people who have received these vaccines, there have been many fewer severe adverse reactions than we normally see in virtually all other vaccines. As a physician, I'm actually eager to have all of our routine vaccinations transition into mRNA vaccines. This is definitely the future.
Very nice. I know a
How did
lot
I
of
do?
people, you did very well.
Okay, good.
They were talking about, there's like 8 people that had an allergic reaction,
Mhm.
and the media tends to blow it up as if that's a very large number,
You
but
bet.
in proportion to other vaccinations, this is actually very teeny tiny, correct?
Very, very teeny tiny. Yeah. And I know there were a couple of anaphylaxis. So far, none of these have been lethal. And we should be very clear about that. And in virtually every other vaccine, there's always a fatality out of, the many, many, many people that receive them. This is, again, by far the safest vaccine in the history of vaccines. There were a couple of anaphylaxis on the first day in the UK. I know there's been a severe reaction of an individual up in Alaska, and then a couple in Chicago. And that was as of Monday. There's probably some more by now. We're vaccinating, 100,000 or more every day right now. Again, none of those have been fatalities. And from what I've read and heard so far on calls with the CDC, during their investigations, all of these people have had a history of, seems that the commonality is strong reactions to certain foods, and they haven't narrowed it down. I can't imagine that food allergy would cause you to react to the mRNA. It's more likely that the spike protein has some mild homology to, who knows what, tomatoes or some protein in something else, some food. And that's what we're reacting to. It may be the lipids that they're, nano coating the mRNA with to make the vaccine. But that seems to be the common factor right now. So, when we're registering people, getting them scheduled to come to our drive-through sites to get vaccinated, those are the questions that we're asking. And the folks that have contraindication, that should not be getting scheduled to get vaccinated with either the Pfizer or the Moderna vaccine. And we can talk about some differences between them. The folks that shouldn't get scheduled are folks that have had a severe reaction to any injectable medication. That is anything IV, anything injected, an antibiotic in the arm or anywhere else, or a vaccine previously. And now we're sort of broadening that out to anybody who's had any kind of severe reaction to a food of any kind. So I mean, that eliminates folks, but that's a very small portion of people. And moving forward, when the CDC gets this figured out, there will be some options for those folks. And we can talk about, the kind of the treatments. We can talk about the prevention, the mitigation measures. We can talk about the treatments for COVID-19. Why we're just doing so much better now than we did back in April with regard to fatalities, for example.
Yeah, I did hear also that when it comes to like side effects and reactions, that it was more likely to happen after the second step in the
Yes.
vaccination.
Yep, you bet.
Okay. What
More
are the
likely,
big?
but we have had these 3 pretty severe reactions. Now, we personally, but those using the Pfizer vaccine have had 3 fairly severe reactions after the first dose.
Okay.
And again, all those had prior food, allergies, I guess we would call them.
Yeah, very interesting. So
Yeah,
it is.
it's kind of curious. But again, speaking of reactions and side effects, both of these vaccines seem to have a higher side effect profile. And by that, let me define that. Side effects, and we're talking relatively mild side effects, things like, headache, fever, body aches and pains, fatigue, just feeling kind of lousy. the number of people that are experiencing that even after the first dose seems to be higher than you would experience from, I don't know, your annual flu shot, for example.
Mhm.
I guess I'm reassured by that to some extent, because it just tells me that they've selected the right protein to use in this vaccine, the right message. They selected the spike protein, and it clearly ticks off our immune system. It gets it riled up, and there's a response even after the first, dose. So I think they've made the right choice, and we can hope moving forward that the immune response is a lasting response.
So yes, when I'm explaining it to my patients, I always explain that if you get this sort of stuff, it's just your body, it's pumping up, it's getting ready for the fight.
Yeah.
If it ever sees it again. So
Yep.
it's just kind of like your body pumping some iron, getting ready for the battle. So
Good analogy.
very good. So the two different vaccines that are out there, is there any differences between the two?
Yeah, I'm not sure what the differences would be with regard to the immune response. I mean, they're both against the spike protein. They're both an mRNA vaccine, as we described. I don't know why the Moderna doesn't require super cold freezing to be transported or to store. I know for a fact, because I used to purify up messenger RNA to make cDNA libraries to clone and sequence various proteins. And mRNA is especially labile. It's especially fragile. And so it doesn't surprise me that the Pfizer vaccine requires a -80 freezer to store it. And that's, I don't know what that is. That's -100 or 97 or something like that Fahrenheit. That doesn't surprise me at all. On the positive side of that, it makes logistically dealing with the vaccine a challenge. We're fortunate in that we have a number of -80 freezers here at County Health, because we prepared for this. Looking ahead, some months ago, we ordered these freezers. We're ready. But I think the positive is that once you receive the vaccine, that mRNA doesn't get incorporated into your DNA. It doesn't change your DNA. It doesn't even stick around. It is chewed up very rapidly. It's used by the ribosomes. They make the protein and spit it out, and that message is gone. It doesn't change your COVID-19 test. You can get the molecular test, you can get the antigen test. None of that's changed. You're not shedding virus. You're not even shedding messenger RNA. It's gone. So that's the good news. The bad news is it makes it logistically challenging for a lot of facilities that don't have a -80 freezer, or the freezer they have is full of clinical samples or something. So the Moderna only requires your typical -20 freezer. Great. Every hospital, every nursing home, everybody's got a -20 freezer. So, we'll continue ordering the Pfizer vaccine because we're prepared for that. Logistically, we can manage that. All of our drive-through testing and vaccination sites are ready for that, can handle that. And I think the Moderna is great for those smaller hospitals or nursing homes or other facilities that just can't handle the Pfizer. Beyond that, I haven't heard a lot of differences. Both, again, have a fairly high incidence of the fever, headaches, things like that, but not much in the way of data differences. That is, they're both about 95% effective. And I just I've got to comment on that. That's spectacular. Okay. I mean, that's unbelievable. It's just unheard of. On a good year, we can hope for 30 or 40% effectiveness from our influenza vaccine. The flu shot. I'd love to see 40% effective flu shot. That's a good year. 95% is just awesome. everybody needs to get this vaccine when it's offered to them.
Now, in terms of the vaccine, you're saying 95% is after the first shot or the second shot?
After the second shot.
Second
And
shot.
so they're not really sharing the data with regard to how effective they were after the first. And I suspect that's because they don't want people to say, oh, hey, after the first, I had 75%, effectiveness. I'm not going to get the second. They really want people to follow through and get the second. But there are rumors circulating that even after the first, that was pretty decent.
Okay. And so what I'm hearing is for the first shot, you wait 21 days and then you get your second shot, and it has
Yep.
to be the same vaccine, like made by the same company. Is that
Yes,
okay. So people need to stick with the same place that they had their first one done,
absolutely.
develop and do their second one.
Yep.
Okay.
And if they happen to make the mistake and get the first dose someplace and go someplace else for the second dose, and they get, one first and then the other one second, or vice versa, they should stop there. CDC suggested they shouldn't go back and get either one of them as a second dose.
Okay. Now, the other huge question I'm being asked is once they get the vaccination, do they still have to wear a mask?
Absolutely. And so here's the problem. The clinical trials are, what's a good way to put this? The clinical trial plans are etched in stone. They're very rigorously followed. And the endpoint or the metric that was measured in these clinical trials was simply, was it safe? Was it effective? What they didn't do is they didn't extend them out and say, well, for those people who have completed both doses of vaccine, if they do get infected with COVID, do they have a decreased ability to transmit it to others? Okay. Again, there are rumors on calls with CDC that suggest there is decreased transmission if you do get infected after being vaccinated. But officially, they don't have that data. That has not been released. It has not been peer reviewed for publication. And so if we don't know the answer to that, really, even if you've been vaccinated, you need to still wear the mask. Even if you've been vaccinated, there's still a small chance. Yeah, it's 95% effective, but it's not 100% effective. So there's still a chance you may become COVID-19 infected. And if that's the case, you still want to protect those around you that you love and care about. And we still want to put an end to this pandemic.
Exactly. I think we're all ready to get back to our regular life. So
Oh, no kidding.
get rid of the mask rashes that are going on.
I hate wearing a mask, man. I hate it so much.
Yeah.
What I really hate is when I leave my mask in the car and I walk a long distance to go in someplace and then go, oh no, the mask is in the car. Anyway.
That's why every pocket now, it's kind of like chapstick.
That's right. That's right. It's got them everywhere.
Exactly. So you were saying about that some people shouldn't be vaccinated. I know that there's not enough vaccine for everyone right now. It's going to be a slower rollout. I think a lot of people thought that once the vaccine was out, everyone could get it right away.
Yeah, I wish.
Exactly. And I think too, with the hospitals, they're getting it, first as bedside. What do we kind of think it's going to look like for rollout in terms of for Oakland County?
Yeah. So right now we are actually still in the CDC and ACIP. The ACIP is, I have to write this down. I'm looking at my notebook here. ACIP is the Advisory Committee on Immunization Practices. Okay. So they're the folks that, and they're not federal. They're like a private, untethered, non-political committee that gathers experts and votes on things like this. Who should get it first? When the vaccine does roll out, like what should be the order? People get vaccinated. Do we have to monitor them for a while? Do we keep them around and observe them to make sure nothing bad happens? All those decisions really get made by ACIP. And then they make their recommendation formally, officially to CDC. And then CDC rolls it out to the states our state, Michigan Department of Health and Human Services, MDHHS. And then they then pass it down to the local health departments. Okay. We're still working on phase 1A. So 1A is, as you point out, frontline medical responders, frontline medical staff, emergency department, physicians, nurses, assistants, aides, all the folks that are, on the battle lines and frontline exposure. In addition, EMS, so emergency medical services, ambulance corps, basically, folks that are exposed, multiple times a day. And let's see, the phases, 1A, for example, has priorities 1, 2, and 3. It becomes complicated and frustratingly changes seemingly on a daily basis right now. So ACIP voted again on just Sunday, a few days ago, rolled that out on Monday to CDC, et cetera. So these who's included is being changed regularly. We're still working on phase 1A, fortunately, and that's just EMS. We're still registering EMS. We're still vaccinating EMS, every day right now. So that's where we are. When they get to 1B, that's an enormous group. And the frustration there is that, let's say there's 200,000 people in our county in 1B, they're not going to ship us 200,000 doses of vaccine. We can accommodate that. We have enough freezer space, doesn't take up that much space, but they'll trickle it out on a weekly basis. So that makes things frustrated for us and for the people waiting for vaccine. And again, those kind of priorities are still being defined by ACIP and CDC. What I can say is that right now, we're basically, the numbers that we have to vaccinate, EMS, are small enough, and we have direct connection that we just basically pick up the phone and call folks and say, can you get your team in, tomorrow morning? When things roll out and open up, basically to the general population, we will have regular updates on our website. And I've shared that, oakgov.com/COVID, and folks can find our COVID webpage, and there will be updates on that, as well as links to MDHHS at state, links to CDC at the federal level.
Okay.
But
so when
we
that
have honestly
comes out, will it come through the county then, or is it going to be, say, like through their doctor's office? Like we provide home care.
It depends. It depends. So, and again, it's really odd the way the kind of federal level decided how to do this. The rationale wasn't entirely clear. But for example, skilled nursing. So I hate to use the term long-term care, because long-term care is just this enormous category that includes, nursing homes, memory facilities, independent care, independent living, and it's huge. So skilled nursing, per the CDC, is contracted with pharmacies, specifically CVS and Walgreens, have contracted with the federal government to go into the nursing homes, skilled nursing, and vaccinate those folks, their staff and residents. Outside of that, though, we've got a fair number of other long-term care facilities that are not registered, they're not licensed skilled nursing facilities, and they really have less opportunity. to be vaccinated. And for many of the residents, it's difficult for them to get out and drive to our drive-through. So we're preparing to have basically strike teams go to these facilities and move through them as we did for testing. Early on, we would just go out and test. We'd go door to door in these, high rises and facilities and just test people. We'll do the same thing to vaccinate.
Okay. Now, in terms of keeping track of those vaccinations, are you guys keeping, a database? Is the federal system keeping a database, tracking everyone that was vaccinated?
Yeah, I'm going to throw out an MCIR, right, MICR. So MICR is the state database, and I can't remember what those letters stand for. Immunization Registry.
Okay.
So there's an immunization registry that we put everyone into. And so there's a record, of course. And there is they also received the vSafe app that they can record any reactions. Once they're away from the vaccination site, that's a federally supplied app. And they can also, if we have more severe reactions, we report it on something called VAERS. I can't remember what those letters are, what it stands for, but there are official databases and registries for those that have been vaccinated and any reactions.
Okay. So it's good for people to actually type in what reactions they're having, and that way it's more information.
Oh yeah, absolutely.
Scientists to
Yeah, I
use.
mean, the more information we have, the more moving forward, these vaccines can be tweaked to reduce side effects and improve the immune response.
Okay. You were saying about like the food reactions, but is there anyone else that really should not be getting this vaccination? Like, can pregnant women get it? Children?
Yeah, that's a good question. This is this is boomer health, right?
Mm-hmm. I think a lot
Yeah,
of people are just worried about,
not a lot of boomers
grandkids.
pregnant. I think
Yeah.
the youngest boomer is 56 right now.
Very true.
I suppose it's possible.
Yeah.
They're going to want to tell their kids.
Yeah.
So the official recommendation by CDC and FDA was that pregnant women should pause, consider, discuss with their obstetrician. I'm going to follow the ACOG, the American College of Obstetrics and Gynecology recommendation, which was after consideration of the fact that there were, in fact, unknown to them, women during the clinical trial who did become pregnant, and there were no adverse effects on the women or the fetus. I'm going to follow the ACOG's recommendations to not put any obstacles in the way of pregnant women being vaccinated. I think basically what it comes down to is this. For a woman who's pregnant, the risks associated with becoming COVID-19 infected probably is, with all the data we have, all the information we have, far outweigh the risks of receiving the vaccine against COVID-19. So that would be kind of the risk benefit balance direction I would head in, is being vaccinated.
Very good. Do you guys see any like, we've heard a couple people where it's like, a little bit of jealousy going on where, there's a healthcare worker in the house that was able to get their vaccination. The rest of the family can't get it at the same time, correct? It's going to be based off
Correct.
of, what you're doing for a living, how much, is going.
It's based on your exposure.
Okay.
And honestly, I actually did not want to be vaccinated, and not because I have anything against the vaccine. This is a great vaccine. Everybody should become vaccinated if they're offered it. But because there's such a limitation, and because I have a closet full of PPE here, I'm testing people every day. I'm exposed every single day, and I have been for 10 months. But every time I'm exposed, I'm in an N95 and a face shield and a gown and gloves. I feel well protected. I feel very safe. I don't think I could be any safer. And clearly I've not become infected during that 10 months of daily exposure. However, I do live in a multi-generation household. I'm a boomer. I'm getting up there in, let's call it maturity. And, I have a fairly high mortality rate if I'm COVID infected, and it's doubled if I'm influenza infected and COVID infected, and it's a co-infection. And I just wanted to avoid the risk that I might become COVID infected, be asymptomatic, and take it home to the elders in our household. And I really, they suggested I get it, and I did for that reason. I didn't have any side effects. It felt like somebody punched me in the arm afterwards, 2 days later. But, frankly, I would rather have every side effect listed for the vaccine than be COVID infected, especially to avoid the fatality risk and the potential long-term symptoms, these multi-organ system effects that people are reporting months after they've recovered from their infection. That there's just no reason, there's no downside to getting the vaccine. There's no reason not to. I was hoping to save it for somebody more needy, but there you go.
And I think that's a good point too. I think a lot of people are focused on, the death rates. They're not focused on the long-term disability and effects that people are having from this,
Yeah.
even kids, the effects they're having. So I
Yeah,
think
we have too many tragic cases of very young kids, very young, otherwise healthy people. Everybody hears that, oh no, you have to be morbidly obese or you have to have all these chronic conditions to have, great risk with COVID. No, I'm sorry. There are perfectly healthy people that are not morbidly obese, don't have any chronic conditions, and they're gone.
Yeah.
So
Well, is there
everybody should
anything
get the
else you'd like to
vaccine
share us?
when they're offered it. What's that?
Anything else you'd like to share with us today?
Yeah, it's not too late to get a flu shot. It's not too late. People that have not gotten the flu shot, get out there and get the flu shot. If you don't care about yourself getting the flu, at least protect those around you. And again, if you get influenza and COVID-19 infection at the same time, it doubles the potential for you to die. So just do that. Wear a mask, maintain some distance. Don't gather in big groups indoors for the holidays. I know we're a social species. I know we all miss hanging out together. I certainly do. But we really need to put an end to this pandemic. So, I think Michigan did a great job over Thanksgiving. We didn't see an enormous bump of cases after Thanksgiving. So let's hold to it. Be good, Michigan. Keep us safe.
Exactly. That nice look out for your neighbor type of mentality.
Yep.
So very good. Well, we appreciate you coming on to the show today and helping us out with
No.
some of these questions.
Thank you, Megan. I appreciate it.
Debunking a lot of what we're hearing. So we very much appreciate that.
Happy holidays to everybody.
You too, and to
Thank you.
everyone out there. I'm Megan Girvin. I'm the clinical nurse supervisor at Ameristaff. If you guys have any questions or any home care needs, need us to come out and help, please let us know, 248-288-2270. And again, be healthy, safe, take care of, neighbors, family, and everyone around us. Have a good day.
Thank you for joining us on Boomer Health at Home. My name is Greg Jamian, and I bring you our series on Boomer Health so we can explore together important healthcare topics impacting the baby boomer generation today. As a home health professional for over 40 years, I'm happy to share my team's knowledge as baby boomers seek answers to difficult healthcare questions. This show provides valuable resources, ideas, and tips, and cutting-edge solutions that will improve your everyday life and health. Don't forget to join us for all the other shows in our Boomer Health at Home series.